on a computer. Welcome to Dr. Lottie's Science with Soul. I'm Dr. Lottie and the host of this podcast. Today, I am really excited to introduce Dr. Iris Kerin Orbuch. So let me read her bio to introduce her. Dr. Iris Kerin Orbuch is the director of the Advanced Gynecologic Laparoscopy Center in Los Angeles and author of Beating Endo, How to Reclaim Your Life from Endometriosis. Dr. Iris Kerin Orbuch's practice is limited to laparoscopic and robotic gynecologic surgery. Her training under the guidance of Dr. C.Y. Liu and Dr. Harry Reich, both pioneers in the field of advanced laparoscopic surgery, allows Dr. Orbuch to be one of a handful of physicians across the country trained to perform advanced excision of endometriosis. Dr. Orbuch provides both compassionate and individualized care while performing advanced laparoscopic techniques at St. John's Hospital in Santa Monica, California. Dr. Orbuch is board certified in OBGYN and is a fellowship-trained endometriosis excision surgeon. She sees the value in addressing endometriosis, an inflammatory disease, via Eastern and Western approaches. The cornerstone of endometriosis treatment is surgical excision of endometriosis. Though she understands the importance of incorporating integrative medicine and combining Eastern and Western medicine approaches in helping her patients heal and getting them on the road to recovery. She regularly collaborates with integrative nutritionists, pelvic floor physical therapists, pain psychologists, gastroenterologists, acupuncturists, naturopaths, and integrative medicine physicians in order to help her patients. When you visit her office, you won't find a rushed, impersonal environment. Instead, Dr. Orbuch and her staff are committed to providing personal, compassionate services to each and every patient. Dr. Orbuch is devoted to helping women live a productive and pain-free life. She loves treating all patients with endometriosis, though helping teens and adolescents is her passion. She was the former president of the AAGL Endometriosis Special Interest Group and has published numerous articles and chapters and lectured extensively. So welcome, Dr. Orbuch. It's such an honor to have you as a guest today.
Thank you so much. I'm so excited to be here to talk about something that I'm so passionate about.
So you are an endometriosis excision surgeon. So for the listeners who are not familiar with what endometriosis is, can you just briefly tell us what endometriosis is and what is the difference of a surgeon like you who is an excision surgeon versus a regular surgeon?
Sure. So endometriosis is a disease that's very common. Roughly about 10% of women suffer from endometriosis. So it's 1 in 10. And those seek typically on average of 8 physicians over the course of the decade until they're finally diagnosed. But essentially endometriosis can affect the entire body. It causes a whole host of symptoms. Some suffer from gynecological symptoms like painful periods or heavy periods, painful sex, or infertility. Others have primarily gastrointestinal symptoms like constipation, diarrhea, alternating constipation and diarrhea, bloating, painful bowel movements. Some suffer from urological symptoms like urinary urgency, frequency, getting up at nighttime to urinate. Overall, most describe a lot of fatigue, and some suffer from back pain. So it affects just about every system in the body. But scientifically, what it is when you have cells that are similar to the lining of the uterus, which is known as the endometrium. They're not identical, but they're similar. And those cells are found external or outside of the uterus. So month after month, when exposed to hormones from the ovaries, those implants of endometriosis just get deeper and deeper and deeper, but there's no exit point. And the disease affects symptoms in a structural way as well as an inflammatory way. So it starts to pull the pelvic anatomy to the right or the left or the back, and then it pulls on the underlying muscles and the fascia. And secondarily, from an inflammatory point of view, those implants are very pro-inflammatory, and they set off all these chain cascades of inflammation that affects us from head to toe. So as a surgeon, my specialty is cutting out or excising those endometriosis implants. So literally removing the entire implant that's pulling the anatomy to the right or the left or the back, as well as removing the inflammatory implants to start downregulating the inflammation in the body. So excision of endometriosis is really the gold standard of treatment for endometriosis. However, most gynecologists are trained in the wrong kind of surgery. So when I was a resident in Manhattan, I learned how to do the wrong kind of surgery for endo, and that's known as ablation of endometriosis. Some people call it burning or fulguration or cautery. It's a very, very superficial burning of, like, what I would say the tip of an iceberg. So it's pretty much leaving most of the implant there. And it really doesn't solve the problem at all. And, you know, it's so sad that it takes almost a decade from symptom onset to diagnosis. And then most patients are landing in the operating room, having the wrong kind of surgery. Then they continue to have debilitating pain. Then the journey continues. And it's just so devastating.
And why did you decide to become an excision surgeon? Was that after working in Manhattan? Did you see patients coming back, or what led you to getting that specialization?
You know, when I was in my residency in my first year, when I walked into the operating room and I watched an endometriosis surgery, I just knew, first of all, I loved minimally invasive surgery. I love anything with hand-eye coordination. I am and was a pretty big athlete growing up that requires a lot of hand-eye coordination. And I played a lot of video games growing up also, and that kind of lends itself to minimally invasive surgery. But when I walked into the OR and I watched my first endometriosis surgery, I was just like, I was drawn in, like, this is what I want to do. And yeah, I was listening to that bio. I'm like, did I really do all of that?
So when you're working, what do you typically see? Who is your typical patient? What do they look like? Have they typically had a lot of surgeries, or?
You know, I don't really have a quote unquote typical patient. However, I'm about 20 years in from when I started doing what I'm currently doing. And patients today are different than, 15 to 20 years ago. And I think because of the advent of the internet. So I'm having more and more adolescents and 20-year-olds in my practice currently. Whereas when I finished my fellowship, the bulk of my patients were 30s and 40-year-olds. Now, don't get me wrong, I still see tons of 30-year-olds. I still see tons of 40-year-olds. I see people who are suffering with infertility for years and no doctor mentions endometriosis. But I'm seeing more and more teens and college students.
So the teenagers, do they typically get put on birth control, or do they get routed to you? How do they find you versus, I mean, you hear all these stories of teenagers that go years and years and years seeing gynecologist after gynecologist, getting birth control, all different versions of it, and trying all different methods until they finally get to somebody like you. So do you see that a lot with the teenagers, or are they just lucky to find you?
I exactly what you described is what I see pretty often, because first the teens are going to their pediatrician, who's going through a cycle of this birth control, then try that one, then try that one. Then they go to the gastroenterologist because they have gut issues, and then they're diagnosed with irritable bowel. Then they go on and on and on. The way that I'm getting 12, 13, 14, 15-year-olds, so pretty soon after they're starting to have pain, is if they have an affected family member who has had endometriosis and went through that spiral of 20, 30 years until they finally heard the word excision. So it's the moms who I operated on when they were in their 40s, who are then bringing their teenagers to me, if that makes sense.
Yeah.
Or if an aunt had it and they went through that 20 plus year diagnostic delay and then first heard about it. Or thankfully, with the advent of the internet, the moms who just don't give up, and or the dads or the siblings or like the family member who's just wants answers, and they just start digging and digging and digging online. And then that's typically how the younger population comes to find me or another excision specialist.
Yeah, it is fascinating to because I just graduated as a naturopath in 2016,
Mhm.
and we did not learn about excision surgery for endometriosis, even though naturopaths are taught to go to the root cause.
Mhm.
It's still missed a lot in our education, not even understanding the depth of the disease itself. It's more, I think, taught as like a hormonal problem and inflammatory problem. And if you eat right and take the right supplements, check the hormones, balance the hormones, this endometriosis is going to go away. What do you see, or what do you have to add to that? Do you feel that that is valid, or we're wasting our time and we should just send all those patients to an excision surgeon from the beginning?
I think a collaborative approach is what works best. And that's why when I wrote my book, Beating Endo, How to Reclaim Your Life from Endometriosis, it's literally what I do with all of my patients, meaning I'm very Eastern in my approach, even though I'm an MD. And it's from head to toe, mind, body. I'm big into the gut. And especially because there's such a diagnostic delay and there's systemic or body-wide inflammation in most organ systems, or the endocrine system, they're all affected by this inflammation. You need to approach it in this multimodal approach. So I think what's best is for you to do what you do, get the gut balance, boost the gut, because the gut is so important. And down regulate the mind, and mind body, get people moving and exercise. But I think what's so important is very early on to mention to the patient, hey, I really think you have endometriosis. I think you should go meet an endometriosis specialist while we're doing this holistic approach, at least so you can understand what's going on. But you have to be very careful. I'm a surgeon, and although I love to operate, I'm not scalpel happy. I do know that excision of endo is the cornerstone of treating and removing this inflammatory approach, but I always tune up my patients before I get them to the OR. Or if I get a 12, 13, 14-year-old in my office, I educate them. I send them to pelvic floor physical therapy. We start working on their gut, because at that point, they've already had 1, 2, or 3 years of inflammation, and probably longer. We think people are born with endometriosis. So they've really had 12, 13, 14 years of inflammation. So I like to educate them so they don't feel I just like to educate them, because there's so much misinformation about endometriosis. And I give them a lot of kind of homework to do. Homework meaning kind of what you do as a naturopath. And then they stay in touch with me, and then we continue to work together. And then when they're ready, we do excision surgery. But I never jump to surgery as the first thing I do with patients, unless they've already started pelvic floor PT. They're working with, like, I love when I look at I always read every note that comes into my office before I see a patient. And when I look at the medicine list and I see tons of supplements and herbs and all of these things, and really integrative blood work or stool tests or different things that are ordered, I'm like, okay, fantastic, because that patient already understands the value in an integrative approach. So I think collaboration is best, and education.
So if people take this approach, let's say they start taking the supplements, they have a cleaner diet, they start eating organic foods and avoiding all the junk food that can create inflammation, and then their symptoms get better. So let's say they get better for a year or two, and then the symptoms return, even though they're still doing the diet and all the supplements. So can endometriosis become better for a couple of years and then get worse again? I've heard people say, I told my OBGYN that, my symptoms are not better. And then they said, well, it can't be endometriosis then.
Yeah. Everyone is completely different. And I almost feel like there is this invisible threshold. And like someone can have pain or discomfort. And if you're below that threshold, you can be okay. So if you initially go to the naturopath and you're above here, and then you start to eat organic and anti-inflammatory and cleaner food, and you're hovering right under here, then symptoms may be better because everything is being channeled through the central nervous system. But then throw in a life stressor or some other kind of stress or school stressor, then symptoms can flare. I've seen patients' symptoms wax and wane, and I always let them know I'm here for them today, tomorrow, and 5 years, like whenever they're ready, I'm there for them. I don't push anyone to surgery, though I do let them know, yeah, we can get you into pelvic floor PT, which I always do beforehand, but if your anatomy shifted all the way to the right and all of your pelvic floor muscles and your abdominal muscles and your back and your gait is off, there's only so much a PT can do. We need to excise the endo, put the anatomy back where it belongs, and continue the PT. And then by excising the endo, you're removing the inflammation, then you can get even better with the gut. I think the problem is patients don't realize how bad they feel until they feel well, because it's a very slow, they just get used to how they feel. No, that's just how I feel. So only once they feel well, they're like, I can't believe I lived like this my entire life.
Yeah, I think people, many patients don't know how bad they really feel. And they think that everybody else has the same issues, but they're not realizing that, for a long time that their problems are actually worse. I know that there's something called central sensitization, and it's sometimes seen within the community of endometriosis patients. Can you describe what happens in a patient that is experiencing central sensitization, and what would you do to treat that?
Sure. So when I first learned about central sensitization, I was at our minimally invasive international meeting, and the keynote speaker was an orthopedic surgeon. This was many years ago. He never used the word central sensitization because it wasn't until I read the work of Pam Stratton and who is the co-author on that paper? Karen Berkeley, did I really understand what central sensitization was. But I think this concept is really easy to understand. So he was an orthopedic surgeon, and he wanted to understand, why do some patients have a really prolonged recovery post, like a right knee replacement? And why do other people, after they have their right knee replacement, utilize very little narcotics and go home on the same day? So he started doing those body maps for patients who were coming to the office for their first visit. So the body map, for those who don't know what it is, it's like a cartoon of the front of a patient and the back of the patient. And you're supposed to put an X wherever things hurt. So if your right knee hurts, you put an X on the right knee. So he found that those patients who only X that right knee, those were the ones who were able to have their surgery, go home, and utilize very little narcotics. They were on their way, no issues. The ones who X the right knee and the left shoulder and the left ankle and the right shoulder and the back, everything hurt in their body. Those are the ones that he realized were going to need to be inpatient, needed to stay in the hospital for a long time. And he didn't use those words, but they were centrally sensitized. Essentially what it means is that the central nervous system's on fire. It's receiving all of these multiple upregulated inputs. And when I heard that lecture, something inside of me was like, huh. And so that's when I started really studying the central nervous system, and I reached out to Karen Berkeley. I mean, this is years and years ago, to better understand what was going on. So central sensitization is basically your central nervous system is on fire. A lot of patients will report, the pain all over the place. Many report burning symptoms, shooting pain, like nervy pain as well. And those are the patients who we really need to identify. I mean, I do this for any patient, whether they have central sensitization or not. We need to identify all the different pain generators and treat every single one. And I like to down regulate them all going into surgery then do a good excision, then continue the treatment afterwards.
So do people get this central sensitization from having endometriosis?
Yeah, any pain generator can cause central sensitization. And anything that causes chronic pain, it could be a car accident. But yeah, endo is one of those, especially when you consider the 10-year delay in diagnosis.
Oh, I just wish we could get that education changed in medical school so that people who go through medical school understand what endometriosis is and the severity that that can cause. So where do you typically see endometriosis as a surgeon? What organs?
Want to touch on that because that is starting to happen. So Shannon Cohn, who's the producer of the Endo What film and the Below the Belt film, she's working together with, is it Harvard? I think it's with Harvard. And they are starting to put all of that together in hopes of incorporating into medical education, like how we've also done with student school nurses and nurses initiative. And so that is in the works, by the way. Okay, what was your question before I?
No, I love that, the fact that it's actually, the change is coming.
Yeah.
I know you just touched on the movie. That's one of my other questions. So you were at the premiere of this new documentary called Below the Belt. So what can you tell us about this movie? I know that you're in this movie, right?
Mm-hmm.
Mm-hmm. What are you allowed to tell us?
Oh, sure. Well, it just premiered in London yesterday. It'll make its way across the world. And essentially, so Shannon Cohn, who's the producer, she's a huge advocate. She's a lawyer and a film producer who's really done an amazing job raising awareness. She's such a smart colleague and friend, and she has really been trying to change the narrative of the disease. And so she's really smart. She studied the AIDS movement and the breast cancer movement, the AIDS awareness. Like, why is it that we're picking up breast cancer very early now? Why is it that there isn't an AIDS epidemic? How did we get out of that? So she realized that you have to first educate people, and then you need to kind of raise awareness sort of in a social justice way and get patients to rally. So the first movie, Endo What, I'm trying to remember when it premiered. I want to say somewhere around 2015, premiered also in New York and then went internationally. And you can watch that. And I encourage everyone to watch it. I think you can watch it off of endowhat.org or endowhat.com. I think it's like a nominal amount to watch the film. And I believe 100% or close to 100% of the proceeds go to put a copy of that DVD in every school nurse's office across the United States. So that came out. And then this movie, Below the Belt, which premiered, I forget, it was like the third week of May in New York at the MoMA, is following 4 patients with endometriosis. I'm trying to remember, Shannon, I think, was filming for close to, don't get me wrong, like 6 years or 10 years, following these patients who really opened up their lives to the camera. And it was a really powerful film. And the movie was dedicated in honor of Orrin Hatch, and Hillary Clinton actually opened up the film and stayed to watch it. And then they've gotten other support from other bipartisan support. And like Rosario Dawson is one of the executive producers, Mae Whitman, Corinne Fox, and there's just so much energy behind this film. The producer, the writer's incredible, and the sound. I mean, I've been working with Shannon on this for quite a while, and the final cut was unbelievable. And it's really starting to raise awareness. In the panel we had afterwards, we had a New York Times health writer who led the panel, and there was I think this is really the beginning of a lot of change. It's about time.
Yes, it's definitely about time. It's been too many years, too many women suffering, not being able to work. What kind of issues do these women come across that are struggling with endometriosis?
What kind of, you mean in the film?
No, like in general, do they, that your patient base, do they miss school? Do they miss work? What is the severity that you see with the patients that end up on your table?
Yeah, typically it's such a range. There's some, by the time they get to me, they've really debilitated and suffering, because it just takes a while, unfortunately, even in the age of the internet, to find an excision specialist. But most people, they're suffering. Their lives are lost. There's an extreme of X days a month to X weeks a month to the entire month is just revolving the schedule around when they know they have pain. Some people have pain the week before their period. Some people have the time like during their menses. Some people have the week after. Some people have mid-cycle or ovulatory pain. Some patients have pain all month long. So, they're losing out on social connections. They're losing jobs. They're going out on disability. They're just really not living their lives to the fullest. It's just so devastating to watch, when this should be, like, gynecologists should be taught, like, it's really crazy. I mean, I give grand rounds to anyone who will listen to me. I talk to pediatricians and family practitioners. I talk to, if I get a psychologist who calls me about a patient, I'm like, give me a half an hour. Let's do a Zoom call. Let me educate you. I mean, I will nonstop try and educate anyone who wants to listen to me. And if it's so easy to make the diagnosis, if those physicians would be armed with the proper information. So usually when I entitle a lecture, an intro lecture to someone, I'll call it Endometriosis Hidden in Plain Sight. Like, it's right there. Let me teach you these questions. You can pick it up. Let me teach you how to examine a patient. It's right there. Yeah.
So what do you typically see with the teenagers, because they're younger? Because many times I've heard gynecologists will tell the patients that, oh, it's, the menstrual pain you're experiencing will go away in a year or two. It's just because your menses just started.
Yeah.
And what do you typically see with these teenagers?
I say, if it's interfering in your life, or you're changing plans, or you're revolving your plans around that time that you have pain, it's too much. That's what I tell them. And that's the truth.
No, that's such good advice. Because many times the teenagers are just taught to, suffer and go along with it, or been even told that it's just in their head, or they're just exaggerating it,
Right.
because they don't like gym class in school, or they don't want to go to school. So I'm so glad that they're finding their way to you. And when you do surgery on these teenagers, do their lesions look different than somebody who's older, in their 30s or 40s?
Yeah. And that's the big thing, is that the teenagers tend to have clear endometriosis, where I've seen clear in 20-year-olds also, but like a 30, 40-year-old is usually brown or blue or red or black or white, which is fibrotic. So it looks different. So what's happening is, if a general gynecologist is operating on a patient, they maybe recognize two appearances of endometriosis. They recognize a powder burn lesion and a chocolate cyst. Like, that's it. That's what I learned in residency. In my first week of residency, I always tell my patients, I learned more than I did in 4 years of residency plus 4 years of medical school. So in 8 years of my education, I learned less than my first week of fellowship.
Wow.
So sad. It makes me so angry when I say that.
Yeah. Yeah. But that's also our education system.
Mm-hmm.
That is set up that way. So let's switch topic. Let's talk about your book. You wrote a book called Beating Endo: How to Reclaim Your Life from Endometriosis.
Mm-hmm.
So tell us a little bit about this book, and why people should read it, or why people should get it.
Yeah. So it's kind of been my life's work, because as I was seeing consult after consult after consult, when I was back in Manhattan, I had an office in Soho. and it still is. It's like story after story after story of these journey after journey after journey with the gynecologist saying it's in your head because your ultrasound is normal. Sex hurts, drink a glass of wine before you have sex, or these awful things that we're being told to patient after patient. And I'm like, how? I can only see one patient and my consults are about an hour and a half or longer. How many patients can I see in a day, right? Especially like I was in the OR for a lot of the day today. So how can I get endometriosis information out on a broader scale? So I'm like, let me write a book. And it's exactly how I approach my patients, like a holistic approach. So this way, the patients can take their book, no matter where they are, what city they live in, what state they live in, what country they live in, and they can take it to their gynecologist and say, at least, you know, this is what they're saying. Or can you give me a prescription for pelvic floor physical therapy? Can you give me a prescription to evaluate small intestinal bacterial overgrowth, you know, or see, and they can start cleaning their houses of all of the terrible stuff that is, you know, in a lot of products, and they can start eating healthy. I wanted to give the power to the patients because the doctors are taught to look at every patient with this like myopic lens in 6 minutes. Well, you're not going to be able to help someone in 6 minutes, and you're not going to be able to help them because our medical system is broken. That doesn't teach us to think in a head to toe approach. So figure we got to get patients involved, get them educated, get them better, and drive the change.
And as a surgeon, where do you see endometriosis in the body? What organs?
So endo has been found in just about every organ of the body. I don't know if this is true. One lecture I went to, it said it's been found in every organ, but the spleen, I never had the time to Google that, but it's been found. We had one patient who used to get nosebleeds every month when she had her period because she had ectopic cell, she had endometriosis in her nose. People have it in their lungs. They can have collapsed lungs when they have their period. It's been found in muscle. It's been found in the heart. It's been found everywhere in the body. But typically, where do I see it? Because I'm a surgeon who's confined to the abdominal pelvic cavity. That's usually where I see it. Yeah.
So, how can people learn more about endometriosis? What's a good way to start this journey? If people are listening thinking this must be my problem, where do I go? Where do I start?
So I'm big, my book has it, and I always say, read it from cover to cover. Don't skip around because every chapter builds on itself. Start with the book, and then at the back of the book, there's tons of great resources. I'm also a big fan of the endowhat.org or endowhat.com, and they have great information. Watch that documentary. The Endo Co is another great group. The Endometriosis Summit is another great organization. Nancy's Nook is an online self-directed educational resource on Facebook. That's another source of great information. And the back of my book lists that plus some other resources.
And if people would like to work with you, how do they find you?
So I'm in LA, but I do consults all across the world virtually and all across the country. My website is lagyndr.com, like lagyndoctor.com. And on Instagram, I'm at Dr. Iris Orbuch, at DRIRISORBUCH. And my office number is 310-850-0051.
That is great. And I will put her website link in the podcast notes. So you can just go click on that and then follow the link to, are your Instagram information also on your website?
Is my Instagram, you know what, that's a great question. I don't know.
Okay. I will put the Instagram link in the podcast notes as well.
Yeah.
So I just want to thank you so much for being a guest on the podcast today and sharing all your knowledge about endometriosis with all the listeners out there.
Thanks for having me. Thanks for you doing what you're doing. And it's been fun. I really hope, even if we can affect one person, then it was worth it, right?
Absolutely.
Yeah.